name is Lydia Tran. I'll be your nurse. Can you tell me your name and date of birth, please?
Joseph, September 5th, 1974.
Okay, let me check your wristband so
Sure.
this is the right patient. How do you want me to call you?
You can call me Joe.
Okay, hi Joe. What made you come today?
I want a head-to-toe assessment.
And then, do you know who the President of the United States is?
Yes, Donald Trump.
And do you know where you're at?
I'm in the hospital.
Okay, so you are alert and oriented ×4. I'm gonna tell you 3 words that you need to remember, okay? So these are car, key, and flower.
Okay. Car, key, and flower.
So how are you feeling?
Yeah, I'm feeling fine.
Okay, so the patient's mood and then his facial expression is is appropriate, and then his voice is also clear. Okay, now let's move on to, let me check your vital signs.
Sure.
To start off, are you in any pain?
No.
No pain. Okay, so let me check your blood pressure. So you're gonna feel a tight squeeze on your arm. Can I have one finger, please?
Sure.
This is the thermometer, temperature. Checking your respiratory rate. Okay, so your blood pressure is 112/87. Your heart rate is 97. Your O2 saturation is 99. Your your temperature was 97.7 degrees Fahrenheit, and then your respiratory rate is 18. So far, based on the results, everything is normal. Can you please step on the scale for me?
Sure.
Okay, your weight is 160 and your height is?
5'8".
Okay, 5'8". Okay, let's start off with checking. Let's start with the head-to-toe assessment. Let me start with your head. So let me inspect and palpate. So far during inspection, there are no infestations. There are no alopecia. Is it painful when I do this?
No.
On palpation, there's no tenderness. As per patient, there is no pain. And also, I didn't feel any lumps, no discharges too, no open wounds. So the head is normal. By inspecting the face, there is no visible facial drooping. There is no involuntary movements. So let's move on to checking cranial nerve number 5. Cranial nerve number 7, which is the facial nerve.
Okay.
Can you please close your eyes tightly? Smile for me. And then frown, puff out your cheek, and then I want you to taste this.
Okay.
Can you taste this?
Yeah. Salty?
Okay, very good. So your facial nerve or cranial nerve 7 is intact. Now moving on, let's check your cranial nerve number 5, which is the trigeminal nerve. Can you please clench your teeth? I'm checking your masseter muscles and your temporal muscles. Good strength. There is no crepitus, so that's very good. Can you please open your mouth? With a resistance. Oh, good strength. Okay, move the jaw from side to side. Okay, now I would like you to tell me if you feel any sharp or dull pain, okay? So how about this?
Sharp.
And this one?
Dull.
Okay, now let's close your, please close your eyes.
Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay. So try based on the result of your examination, the cranial nerve number 5, the trigeminal nerve is intact. Now let's look at your eyes. On inspection, your eyelids, there is no swelling on your eyelids. Your sclera is white and it's clear. And then I want you to look up, check your conjunctiva. Oh, it's pink. Okay, your eyes on inspection is normal. Now let's move on to checking your cranial nerve number 2, which is the optic nerve. Are you wearing glasses?
Yes, I am.
Okay, these are your glasses, right?
Yeah.
Can you please wear your glasses? Let's check your optic nerve with the use of a Snellen chart. So you're 20 feet away and read the lowest line possible. We'll start off with you closing one eye.
Okay. DEF, P-O-T-E-C.
Okay, and the other side, please.
D-E-F, P-O-T-E-C.
Okay, very good. Based on the result of the examination, you have a 20/20 vision, meaning that's a normal vision, meaning like you could see in 20 feet what a person with normal acuity could see in 20 feet.
Okay.
Now let's move on to checking your different eye movements. The nerves involved here is cranial nerve number 3, which is the oculomotor, cranial nerve number 4, which is the trochlear, and cranial nerve number 6, which is the abducens. Let's start with the the 6 cardinal cases. I want you to look at the pen light and follow its movement without moving your head, okay?
Yep.
Okay, so far you're able to follow the movement. And now let's I'm gonna shine a light on your eye. Can you please stare at the wall? So both your pupils reacted and constricted to light. Now I want you to look into look at the pen light and follow it. I'll move it near to your nose. Okay, so your eyes is responding to the accommodation and convergence. Now I want you to I'm gonna put it in front of one eye and stare at the wall for me. Okay, I'll do the same on the other eye. Okay, so based on the exam, the result is your cranial nerves 3, 4, and 6 is intact, okay? And there is no involuntary movement, so you don't have nystagmus, there's no strabismus. The same time, your pupil is around, the size of your pupil is around 4 millimeters. So it's your pupils are equally round, reactive to light, and accommodation, so that your cranial nerve is normal. The optic nerve and the cranial nerves 3, 4, and 6. Now let's check your ears. Okay, on inspection, your ears are normal. Is it painful when I do this?
No.
Okay, so there's no pain, no tenderness. There are no masses, no lesions. How about this one?
No.
None. So okay, it's the same on the other ear. And now let's check your hearing. Okay, so this involves the cranial nerve involved with the hearing is a cranial nerve number 8, which is the auditory. Okay, I'm gonna whisper something, and I'll occlude one ear and tell me if you could hear it and tell me what the word is. Okay.
69.
Okay.
20.
Okay. So you were able to listen, you were able to hear the words properly. And now let's do the hearing test. The first test is what we call the Rene test. In the Rene test, I'm gonna ping the tuning fork, put it behind your ear, lift your finger like this if you don't hear the sound anymore, and then move it in front of your ear and listen to the sound. And as soon as you don't hear the sound, you lift your finger like this. Okay? So let's start with the Rene test. Okay, so we'll repeat the test on the other ear. So which one did you hear longer? Is the first one or the second one?
The second one.
Okay, so air conduction is longer than the bone conduction, which is a normal result. Now let's move on to the Weber test. In this test, I'm going to ping the tuning fork and put it in the middle of your forehead or your head, and then let me know if you could hear it equally on both sides,
Sure.
okay? Okay, so you hear it equally on both sides?
Equal on both sides.
Okay, so very good. So your hearing and your ear test is a normal. Okay, so let's move on to your nose. Let me look at your nose. An inspection. There's no deviated septum. As we, there are no discharges. Any trouble like breathing?
No.
No. Okay, can you please close your eyes? I'm gonna check your cranial nerve number 1, which is the optic nerve. Do you smell what it is?
Yes. Lavender.
Okay, so I'm sorry, it's not optic nerve, it's olfactory nerve, okay?
Okay.
So cranial nerve number 1, Again, is the olfactory nerve.
Okay.
Okay, next, let me check your mouth.
Okay.
So looking at your mouth, let me see. Your lips are okay. They are normal. They're moist. They're pinkish. But let me look on the inside. Let me see. The buccal mucosa is pink and moist. Your teeth. You have you wear dentures, right?
No dentures.
No dentures, but I could see cavities. Okay, that's okay. So can you please lift your stick your tongue out, put your tongue up. Okay, no sores, no lesions, and down. Let's say ah. Okay, so your uvula is in the midline. I'm gonna check your gag reflex. Okay. Okay. Let me see. Okay, very good. So the glossopharyngeal nerve, which is cranial nerve number 9, is intact, as evident by the gag reflex. Now, can you please drink the water? Okay. Were you able to swallow with ease?
Yes.
Okay, very good. So the vagus nerve is also intact. Okay, these cranial nerve 9 and 10 is intact. These nerves are also responsible for the taste on the back of the tongue.
Mm-hmm.
Okay, let's move on to checking the hypoglossal nerve, which is this is done by you sticking your tongue out. Can you please stick your tongue out? Move it from side to side, and then can you please put how do you call it? Push your inner cheek with the use of your tongue. And the other side. Okay. Is there any pain?
No.
Okay, good strength. So your cranial nerve number 12, which is the hypoglossal nerve, is intact.
Yes.
Now let me look at your neck. So far on inspection, there is no visible nodes or protrusions or masses. Let me palpate your trachea. So trachea is in the midline. Let me check your thyroid. Okay, thyroid, there is no mass. There are no nodules. Can you is it painful when I do that?
No.
There's no pain. Okay, let me check your carotid artery. Okay. So occlude one at a time. So strong bounding pulse. The other side. Very good. And now let me hear for bruits with the use of the bell of the stethoscope. Okay, there's no bruit. And now we'll move on to checking your lymph nodes. Let's start with the use of the pad of my fingertips. I'm going to check the different types of lymph nodes, starting with the preauricular lymph node. Okay, post-auricular, the occipital, and then the tonsillar, submandibular, submental, superficial cervical, posterior cervical. Can you face this way? The deep cervical. The other side, please. The deep cervical, and then supraclavicular. So far, is there any pain when I do this?
No.
Okay, so the lymph nodes are normal. It's not swollen. Okay, now let me check cranial nerve number 11, which is the spinal accessory. Can you please turn your head from side to side? Okay, up and down. And then can you please shrug your shoulder? Okay, very good. So spinal nerve number 11, spinal accessory, is intact. Now let me check the range of motion of your upper extremity.
Mm-hmm.
Can you please hold my hand, let me inspect your upper extremity first. Okay, so good, smooth, soft, no screen breakdown, equal distribution of hair. Now can you please hold and squeeze my hand? Oh, good, very good muscle strength. Okay, can you put your arm like this? I'm gonna push it. Okay, good. Can you push mine? Okay, very good. Now the upper extremity range of motion is normal. I want you to lie down now.
Mm-hmm.
And can you please take your shirt off?
Sure.
So I could oh no, not lie down. Just sit down. Just take your shirt off.
Okay.
Because I have to check your upper your heart, the lung sound, and the lung sound and the heart sound. So far, your chest, upon inspection, is normal. There's no skin breakdown. However, I could see that there is a keloid over here. Is it painful?
No.
No pain, itchiness?
No.
Okay. So now the patient is not barrel chested, and then there's no use of accessory muscles when breathing. Now let me move on to checking the lung sounds. take a deep breath and out. In, out. In through your nose, out through your mouth. Okay. Maybe could be good then. Okay. That is it. Okay. So far the lung sounds are clear. Can I check the posterior lung?
Sure.
Okay. So when you check, it should be between the scapula and the spine. Okay. A deep breath, please. Out. Okay, so far your breath sounds are clear. Can you please face me?
Sure.
And now we're gonna ready to check your heart sounds. Let me palpate first if there are any like thrill. Okay, so there's no thrill. Now let me hear the heart sounds. Let's start with the aortic valve, which is located on the right side, second intercostal space. We'll move on to the pulmonic valve, which is on the second intercostal space on the left side. Okay, next, the fourth and the fifth, we have the tricuspid valve, and then the mitral, which is in the midclavicular line, fifth intercostal space. And here, this is the apex of the heart, so you have to listen for 1 full minute. Okay, so far, so good. Your lungs, your heart sounds are normal. Now, let me check your abdomen. Okay.
Okay.
Can you please lie down for me?
Sure.
So we're checking the abdomen. I could see that the umbilicus is here. No hernias. No, you could relax. There are no hernias. No hernias. Let me cover you. There are no hernias present, and at the same time there are no skin breakdown, equal distribution of hair, pinkish and pinkish on skin. While listening to the abdomen, you'll start with auscultation with the right lower quadrant. Best the vowel sounds is 5 to 30 vowel sounds in a minute. Then we'll do it clockwise here, right lower abdomen, right upper, then left upper, left lower. Next, we'll listen to the bruits in the aortic artery with the use of a bell of the stethoscope, which is below the xiphoid process above the umbilicus. No bruit present. Then renal artery on the right, renal artery on the left, iliac artery on the left, iliac artery on the right. So far, there's no brewing. Now I could proceed with light palpation. Is there pain when I do this?
No.
How about this one?
No.
This one?
No.
This one?
No.
No pain. No, I didn't feel any hard, masses, and there's no, hard area too. Let me do deep palpation. No pain?
No.
Okay, so far the abdomen is normal. Now let's proceed with the lower extremity. You could put in your shirt if you want. So let me look at the lower extremity. So far they are symmetrical. Hair distribution is good. Let me check for edema. No edema on both legs. Is it like, it's warm, it's not shiny? Let me check capillary refill. Okay, capillary refill is good. It's less than 3 seconds. So let me check the range of motion. Can you lift the leg up the other side? Okay, push. Okay, very good. So check your pulses, the dorsum of the foot, which is the pedal of pulses. So if the peripheral vascular system is good. And now let's proceed with the cerebellar function with the heel to shin. Okay, I want you to your heel to put on the below your knee and the shin, and then move down and up. Okay, and then you'll do it on the other side too. Okay, now let's proceed with our function. Can you please walk there and then come back? Very good. Now Romberg test. I want you to face like here, knees together, or the feet together. Okay, close your eyes. Romberg test usually is test for 30 seconds. Okay, that's good. Can you please take a seat? Let's do the rapid alternating movements with the hand. 1, 2, 3. Okay, you could do it. Very good. Next, let's do the finger to finger test. Okay, spread your hands like this, and then put your finger together, and then close your eyes and do it again. Very good. Now let's do the we're done with that one. Now let's do the tactile discrimination. I want you to close your eyes and then feel this. I'll put an object in your hand and let me know what that is.
A key.
Okay, next I'm gonna write something on your hand and tell me what it is. What letter is this?
A.
Okay, very good. Now let's do the 1 point, 2 point discrimination.
Mhm.
Tell me if you feel 1 point or 2 points.
1, 2.
Okay, so you're gonna do that examination with 2 hands.
Okay.
So far, your tactile discrimination is intact. Okay.
Yeah.
Very good. Now let me do the deep tendon reflexes to start off with the brachioradialis, which is 2 inches above your wrist. Okay. So 1, 2, 3. Okay, very good. So your cranial nerve, your C5 and C6 is intact. Now let me do the patellar, which is in the knee. Very good. And now the Achilles. Oh, okay, very good. Now let me can you tell me the 3 words that I asked you to remember earlier?
Car, key, and flower.
Okay, and that concludes our assessment. So everything is normal.
Okay.
Okay, thank you.
Thank you.
Okay, bye.